So, welcome everybody to Wellspring, Alberta. Tonight we are, Dr. Landmann is here to present and talk about the role of acupuncture in integrative cancer care. I'm just going to read her bio. Sorry, I should have had this ready. Bear with me. So, Dr. Jessa Landmann graduated from the Canadian College of Naturopathic Medicine in 2013. Her private practice is at Calgary Integrative Medicine, where she specializes in integrative cancer care. She was a co-investigator of a clinical trial looking at acupuncture for cancer-related pain at the Holy Cross Hospital. Acupuncture is her favorite modality to use in clinical practice and believes there is nothing acupuncture can't treat. So, Dr. Landmann, thank you, welcome, and take it away.
Well, thank you very much, Bobby. And thank you to Wellspring for inviting me here to speak to you tonight on a topic that I am very passionate about. And hopefully after this presentation, you will see why. So the title of tonight's presentation is The Role of Acupuncture as an Integral Aspect of Integrative Oncology. So what does integrative oncology mean? Oh, Bobby, my slide isn't advancing.
Try using your arrows on your
Well,
keyboard. Oh, there you go.
sorry. So just a quick definition. So integrative oncology is a patient-centered, evidence-informed field of cancer care that utilizes mind and body practices, natural products, and or lifestyle modifications from different traditions alongside conventional cancer treatments. Integrative oncology aims to optimize health, quality of life, and clinical outcomes across the cancer care continuum and to empower people to prevent cancer and become active participants before, during, and beyond cancer treatment. What I really like about this definition is that it's talking about empowering, helping people and patients to feel empowered. And in order to feel empowered, that starts with knowledge and information. We need to know what's out there. A lot of people might not be aware of how to help themselves. They might be struggling with certain side effects and symptoms and just not know where to turn or know what could help. So my aim tonight is to provide information, to have a knowledge base so you can feel empowered if you think this is something that could help you, then you can take that step. So this is just kind of a summary of my bio that Bobby already said. So I'm going into my 11th year of clinical practice. My practice is exclusively in the area of integrative oncology. And as she mentioned, it is my favorite modality, and you will see why. I'm also on the steering committee for the Action Center, and the new Cancer Center, there will be a whole floor, a whole wing dedicated to integrative cancer treatment. So ACTION stands for the Alberta Complementary Therapies in Oncology. So I'm on a couple of committees for that as well as a member of the Society of Integrative Oncology, which is a worldwide group of oncologists and nurses and different health professions that are all dedicated to putting forward integrative oncology and advancing the research in that area as well. So the outline of tonight's presentation, I'm going to talk a little bit about the history of acupuncture, and then present results from randomized clinical trials, systematic reviews, and meta-analyses, so you can hopefully understand the numerous side effects that can be effectively treated. I say that in parentheses because that might mean that some might get better, so maybe not completely go away, but maybe they're reduced in frequency or intensity, and some actually can get completely better. I'm going to share some case studies with you from my own clinical practice. And then, as mentioned, we'll have time at the end for any questions and discussions that you might have. So acupuncture was first written down and described in the year 100 BCE. So very likely it is the oldest form of medicine probably on this planet. It was first written down in medical textbooks in Europe in 1680 by a physician who had traveled to Japan and witnessed and experienced the benefits of acupuncture. But despite all that history of acupuncture in use, it wasn't until 1997 that the National Institute of Health put forward a consensus statement and wrote that acupuncture was effective for a few different things, mainly pain, nausea, and headaches, is what was originally endorsed. And since then, there has been a flurry of research, and as you'll see tonight, there is many more things that can be treated with acupuncture. We have different styles of acupuncture as well. So we can do scalp, so on the head. There's actually a lot of research for patients who've had a stroke, for example. Auricular acupuncture, which is just on the ear. You can use laser if people are afraid of needles. Electroacupuncture can hook you up to little tiny electrodes and just intensifies the acupuncture treatment. And acupressure. So this is just applying pressure to acupuncture points. And I love teaching people how to do this because then you can find acupuncture points on your own and do your own little treatments at home for different side effects and symptoms that you might be experiencing. Here's a little diagram of what the needle might look like. So the one on the bottom is an acupuncture needle. They're very tiny. The tiniest one I use is 0.15 of a millimeter. They're very tiny. There's really minimal discomfort. The side effects of acupuncture, though, that could cause a bruise. You might feel a quick little sharp poke when the acupuncture needles first go in, but other than that, it's very comfortable. This is a diagram of all the acupuncture points on the body. So you can see they are all over the face and the head and the front and the back. They're kind of all over the place. And this is a diagram of the ear. Again, many more points that you can just put in the ear that all have different actions. So there's probably about over 400 different acupuncture points. And the ones we choose are based on what you are experiencing. So we can choose any kind of different combination of points to get the effects that we want. So, clinical trials for acupuncture and cancer care. So let's look a little bit about what research is showing on the science behind how acupuncture can help people who are struggling or who are still fighting cancer or recovering from cancer. So a quick note on acupuncture research, just so there's a couple terms I want you to be aware of. When we do research, we always have a group of people who are divided into what we call an experimental group and a placebo group. So the experimental group is, let's say we wanted to look at whether acupuncture could help with sleep. Half the group would get an acupuncture treatment for sleep, and then half the other group would get the placebo. But how would we give an acupuncture placebo? It's not as easy if it was an oral pill or something like that, where you're giving a drug and then the placebo is a sugar pill. So we have what researchers have called a true acupuncture group. So in the true acupuncture group, people are getting points on real acupuncture locations. And then the sham acupuncture group is needles are being placed not very deep, just very, very superficial, but on non-acupuncture points. So that way people don't know whether they are getting a real treatment or a fake treatment. So just so you know those two terms when we're going forward. So the first one we'll look at is something called xerostomia, or dry mouth. This is something that is common in people who've had any kind of radiation treatments for head and neck cancers. This can be really debilitating for some people because, as you can imagine, salivary glands are destroyed. You're not producing saliva, so it is hard to chew and swallow sometimes. People's taste can be affected. People are more prone to cavities, things like that. So it can be quite distressing for people and is often something that is permanent as well because those salivary glands are being destroyed. So here was a phase 3 trial. They had 339 participants. So we had 112 in this true acupuncture group, so we're getting a real acupuncture treatment, 115 in the sham, so fake, 112 in standard care, which was just people who were sucking on lozenges. So if you've had this before, people usually just have xylitol lozenges that can help with the dryness. Acupuncture was given 3 times a week during a 6 to 7 week radiation treatment period. So while they were getting radiation, they were also getting acupuncture. And different questionnaires were used to track symptoms. So the xerostomia questionnaire, as well as some other questionnaires on quality of life and dryness. And scores on the xerostomia questionnaire were significantly more improved in the true acupuncture group compared to other groups. Then 1 year later, they contacted all these people to see how they were doing. And at 12-month follow-up, many people still had improvements that persisted. So even if you're not continuing to get acupuncture long-term, the benefits can last long-term. So this is just one study that I chose. There are probably about 10 other that have also shown success. And this is something that I use quite often in clinical practice. I like the study because it highlights true integrative oncology, where complementary therapies are being carried out at the same time as conventional treatments. So it's very safe to do acupuncture while you're undergoing treatment. You don't have to wait until afterwards. So I wanted to share a couple stories with you. One was a lady, she came to see me. She had had radiation 6 years ago, so it was quite some time, really dependent on lozenges. It was really quite bothersome for her. After that long of a treatment period, as you might imagine, it's harder to treat symptoms that have persisted for a long time. So I wasn't really sure how she would respond, but what she did notice after our treatment period together was I don't wake throughout the night. So she wasn't waking up in the middle of the night as much due to thirst, was getting more quality, restful sleep. And so she was happy with that. Compare this to a lady who had just completed radiation 3 months ago. So same types of things. So always having to drink water, was waking up a lot at nighttime, things like that. After our treatment period, she noticed again less waking throughout the night, not needing to wake up to drink water. She noticed not needing her water bottle. So she said that she went out for a walk and she realized that she forgot to bring her water bottle, which was very strange because she always has it with her, and she forgot about it because she just wasn't feeling dry. She was noticed that it was easier to swallow food and that her taste was a lot better. So bit of a difference, in terms of how far out you are from treatment. So the earlier you get in to do treatment, the better results that you can expect. Okay, nausea. So another common symptom and side effect of people going through cancer treatments. Standard of care are anti-nausea medications. They work well, but many patients experience side effects from these medications. They might feel dizzy or a headache or have digestive concerns. A lot of people who seek me out for acupuncture are kind of might not be tolerating prescription medications very well. And they're kind of looking for what else can I do that works and that is safe. So this was a study looked at 81 women treated with AC chemotherapy regimen for breast cancer. So if you've had chemotherapy, you might be familiar with that regimen. And again, they were divided into two groups. They compared people who just took the standard medications versus people who also continue to take the standard medications, but they also received acupuncture for the treatment of nausea. And they found overall that the combination group had not only significantly less nausea, but less diarrhea and constipation as well. And this study supports the results of many previous studies. Many studies have been done looking at acupuncture and nausea. I chose this study though, because again, it shows the value of integrative oncology, that the combination of conventional treatments plus complementary treatments often produces superior results compared to either one on its own. So it didn't look at just acupuncture for nausea. It was kind of the combination of everything together. And that's really the definition of integrative. Hot flashes. So this is very common in women who are being treated with anti-hormone medication for breast cancer. Can be common in men who've had prostate cancer as well. Hot flashes is one of the main reasons for poor adherence to this hormone medication. It can be really, really disruptive to people's lives. Standard of care medications are antidepressants, and many studies have found that acupuncture is just as effective. Here was a big study that looked at 415 women who were giving an auricular acupuncture treatment, so that was points on their ears, once a week for 8 weeks. They were given a variety of different questionnaires to score and track how they were doing, the hot flash rating scale and the women's health questionnaire. And they found that the number of hot flashes reduced after their 8 weeks from on an average of 9.6 per day to 5.7 per day. Again, contacted them later at 18 weeks and found that there was an improvement from that original 9.6 to experiencing 6.3. So again, acupuncture, one of the reasons why I like it so much is it's not something that you have to do continuously for many different side effects and symptoms. Even after your treatment is complete, you often will experience benefits. They also found that there was significant reductions in depression, anxiety, memory, and sleep, which you would think would be expected, right? So if you're not having as many hot flashes as a night, you're sleeping better, you're less worried and bothered about them. So often we find that a lot of these symptoms called symptom clusters that often go hand in hand get better altogether. A joint pain from aromatase inhibitors. So this is the class of medication that again is used for women who with a history of breast cancer. They're estrogen blocking medications, and a very common side effect from those medications is joint pain. Women just get them just in their knees, or might have them in their ankles, knees, your wrists, their shoulders, kind of everywhere. Again, the joint pain from these medications is one of the main reasons why women might discontinue long-term use of these medications. So one study looked at 226 women. They were divided into 3 groups. So the TA is the true acupuncture group, the SA is that sham, the kind of fake acupuncture group, or a waitlist control, which is women who were just kind of waiting to, get randomized eventually. They had been on aromatase inhibitors for at least 30 days, and they had to have at least a 3 out of 10 pain score. They received acupuncture twice a week for 6 weeks, and then weekly for 6 weeks, and they were followed up 1 year later. And at that 1 year later, they found overall pain scores were significantly lower in the true acupuncture group compared to the others, and this was a long time persistent benefits. The American Society of Clinical Oncology, which is kind of like the top dog of cancer organizations in the United States, they actually endorsed acupuncture for the use of pain because there's so much robust positive research findings. So kind of sticking with the topic of pain, cancer-induced bone pain. Bone pain might be something that people experience if they've had a metastasis of their cancer. It's spread to their bone, so maybe in their hips or their ribs or somewhere like that, and it can be very excruciating. Standard of care is usually opioid medication, so something like hydromorphone, for example. There was a recent meta-analysis that looked at 13 randomized trials. So meta-analysis is when you take a bunch of trials that have been done and you kind of pool all that data together and look at the overall effects and see, like, overall, is this something that's really been helpful? So looked at a total of 13 trials with over 1,000 people. And most studies compared, again, this acupuncture plus opioid therapy to just opioids on their own. They also looked at time to analgesic onset, so how quickly their pain got better, how long their pain was reduced for, use of breakthrough medication, side effects of opioids, so like constipation or nausea, as well as other quality of life symptoms like pain, insomnia, physical functioning, emotional functioning, and global health status. And all the data on the following slide, which I'm going to show you, was statistically significant. So again, as you can see, this combination group, so acupuncture plus opioid therapy, people had a faster time to analgesic onset, so it worked faster. A longer duration, it lasted longer. They weren't using as much breakthrough medication. Their pain relief was actually superior. So let's just say with opioid medication, their pain was a 6 out of 10. Then adding acupuncture to it might have brought it down to a 3 or 4. So it was actually better pain control. People had less side effects of opioids, so less nausea and constipation, and better scores on all of those quality of life, pain, sleep, energy that we were looking at as well. So again, I chose this study because we can't underestimate the importance of addressing quality of life. Again, this is kind of a highlighting a true integrative approach and what really does happen in real life. I kind of referred earlier to this idea of cluster symptoms. So things that often go together. So let's say someone has pain. Well, they're often not sleeping as well. They might have depression, and they're really, their energy is just sapped, which makes sense. So you can treat one thing like pain, and well, they're sleeping better and their energy is better and their mood is better. So you can treat one thing, it's often a snowball effect from there where everything else just kind of naturally gets better. Pain in advanced cancer patients. So unfortunately and surprisingly, not a lot of research is actually conducted in advanced stage 4 patients, but again, standard of care is opioid medication. We had a study here that looked at, hot off the press here, 2023, 151 patients with advanced cancer who had all sorts of different cancers. So lung cancer, pancreatic, liver, gallbladder, ovarian, breast, sarcoma, blood cancers. They did a weekly acupuncture treatment for 26 weeks. Pain could be from any source. Their average pain scores were 7 out of 10 and had persisted for an average of 3.8 years. On average, after the acupuncture, pain scores decreased by 2.9 points, which was clinically significant. So you can imagine if you had a 7 out of 10, and after acupuncture that was brought down to a 4 out of 10, that's quite a bit of difference. And again, significant improvements were also found on scores of fatigue, insomnia, and quality of life. Insomnia. So as you've probably noticed, insomnia is one of those symptoms or side effects that often gets tracked in other research just to see if their people's sleep gets better too. But some studies do specifically look at this on their own. So here was a study, it was 151 women with breast cancer who all were suffering from insomnia after chemotherapy. So something I see a lot of in clinical practice. Groups were divided into getting a true acupuncture group and the sham acupuncture group twice a week for 4 weeks. Again, found that there were significant improvements in time to sleep onset, so how quickly they fell asleep, how long they were sleeping for, fatigue levels, pain, and quality of life. And interestingly, the researchers also tracked the use of sleep medication over time and found that acupuncture helped to decrease people's reliance on that as well. So we can see here on the left, the scale is the cessation rate. So the percent of people who were able to stop prescription sleep medications, or I think reduce its frequency as well, over 3 time periods. So the first one was after week 6 to 8. The black one is the real acupuncture group. So more people getting acupuncture were able to stop their reliance on sleep medications after 6 to 8 weeks. Got even better from weeks 18 to 20 and persisted long term into week 40 to 22. So even when they still weren't getting acupuncture, they were still sleeping better long term. Cancer-related fatigue. So fatigue is like insomnia, another side effect that gets tracked alongside in other researches to see how people feel. This is one of the most persistent long-term chronic side effects after chemotherapy and radiation. This can be a real tricky one because unlike some of the other side effects like pain or insomnia or even dry mouth, there's no prescription medications for this. There's nothing really that can be given for fatigue. So often people are just told that, it just takes time and over time it will get better, but it can be very, very debilitating. So we have a meta-analysis here that pooled the results of 10 clinical trials, which included over 1,300 people. They found that overall, there was a beneficial effect of acupuncture for cancer-related fatigue. And there were many different ways that it was done. So some people got it for 3 times a week for 2 or 3 weeks. And some people got acupuncture twice a week for 2 weeks, and then once a week for 6 weeks, or once a week for 6 weeks on its own. So there's no perfect way of doing it. You can do acupuncture all different ways. So if you're not close to an acupuncturist and you can't go see someone, 2 or 3 times a week, you can go once a week, and that's fine too. What's important to note here too is that this can be helpful whether you are currently undergoing chemotherapy or you've completed it in the past as well. Anxiety and depression. So again, something else that always gets tracked, but sometimes studies do look at it on its own. often coexist with fatigue and insomnia. And it makes sense that when you treat one symptom, the other gets better. This is a 2023 meta-analysis that looked at 28 clinical trials. So as you can see, there is so much research that has been done in acupuncture and found that, yeah, as we can see, effective at improving anxiety and depression in people with cancer or a history of cancer. And this is another side effect or symptom that has also been endorsed by the American Society of Clinical Oncology. So the American Society of Clinical Oncology, they're more medical based. So for them to endorse complementary treatments is pretty huge. Something called leukopenia or low white blood cells. This is common when you are undergoing chemotherapy, can be a bit of a problem because it puts people at risk for infection, or people's chemotherapy treatments might be interrupted, or they might have to have their dose lowered. So it's something that is really important to pay attention to. And, again, interestingly, like, how does acupuncture increase white blood cells? It's kind of magical, but, a meta-analysis of 10 clinical trials looking at over 650 people on a variety of different chemo regimens for breast cancer received twice weekly acupuncture for 6 weeks in one group or no acupuncture in the other, and found that there was a statistically significant increase in white blood cells, neutrophils, and natural killer cells. So something really important and an easy treatment to deliver if this is something that you're struggling with or you want to prevent. Chemotherapy-induced peripheral neuropathy. So some types of chemotherapy can cause this nerve damage that is often in the hands and feet, and it's often described as numb or tingling, but I've heard all sorts of different explanations from people. Some people say it's like my feet feel like blocks of ice, or my hands feel like someone is squeezing them. There can be all sorts of different subjective symptoms. This is something that can go away on its own, but if not, can become very persistent and also somewhat debilitating and painful for some people. A 2022 meta-analysis showed that acupuncture was effective at reducing pain and improving quality of life. So in my practice, I've had success with all those weird types of symptoms. So numbness or tingling or feeling of cold or burning. Muscle cramps is also really common as a result of peripheral neuropathy, kind of an under-recognized symptom of peripheral neuropathy, but cramping responds very well to acupuncture. The one thing is that, it's frustrating for me as a clinician. It's frustrating for patients sometimes too, but it really is completely unpredictable. I never know how people are going to respond. I've had anywhere from 100% success, so someone's neuropathy has gone away completely, to maybe it's just improved a little bit. Incontinence after a prostatectomy. So men who've had to have their prostate surgically removed for the treatment of their prostate cancer, one risk of that is long-term urinary incontinence because of cutting or damage to the nerves that supply the bladder. And this can really reduce the quality of life in men. So they feel like they always have to wear a pad, or they're always leaking or dribbling if they're just going about their day or doing sports, or have to wake up at night because they feel wet. So it can be a bit of an issue. Standard of care for men is pelvic floor exercises and physiotherapy. There's not a ton of research on this, but I wanted to include it because it's something that I have done and I have found success for. So this study was 104 men who were randomized to either acupuncture plus the physio or just the physio on its own. And the time to recovery, as you might expect, was faster in men who got acupuncture treatment, and their quality of life scores were better as well. Men used fewer urinary pads, and many actually completely recovered. So this is a graph showing the blue graph is the combination group, so acupuncture plus physio. The purple is just physio. So you can see in this cured column, more people who underwent both types of therapies had higher cure rates. And I say and more because there are, a few little trials that have been done here or there, but they're important to mention because these are still things that people struggle with and that are really looking for ways to treat. So cognitive impairment, also known as chemo brain. If you've had chemotherapy, you might struggle with memory or this kind of feeling of brain fog. There was a study here of 80 women with breast cancer who were randomized to get acupuncture or not, and found that, again, there were significant changes in their scores, improvements. Dysphagia, which means trouble swallowing after laryngeal cancer. So this was 71 patients who had to have surgery for their cancer. They're randomized to swallowing training by physiotherapists or the training plus acupuncture. And the acupuncture group had a higher rate or complete success. So 97% of people had complete success rate of having their issues swallowing get better compared to just the physio, which was 60%. And again, when they were contacted 3 months later, these they were still experiencing improvement. And a couple more I wanted to mention that surprisingly don't actually have any clinical trials on them, very surprisingly, but two things that I do all the time in my private practice. So one of them being shoulder rehabilitation after radiation for breast cancer. So it's very common for women to feel tight across their chest or in their neck or in their shoulder, or have pain in their neck or shoulder, or pulling sensations underneath their armpit, or various different things. Acupuncture loosens the fascia around the muscle tissue and is really effective at treating this. It's effective at helping women get that range of motion in their shoulder back and reducing those feelings of tightness and pulling. It works really, really well. And tinnitus, which is ringing in the ears, common with certain chemotherapies. One is called cisplatin. If you've had it, you know it. Tinnitus can be really common for that. And one little acupuncture behind the ear does the trick. And surprising, there's no research on that. But again, it works really well. So I wanted to share that with you. I thought I would just share a quick case study of a patient that I saw last year. This is a woman. She had a double mastectomy without reconstruction for her breast cancer. And a year later, she was still experiencing a lot of pain and burning around her incisions. Very sensitive to touch, hard time of wearing any kind of clothing, always had to wear loose shirts and things like that. She also had a lot of numbness and stiffness in her hands and feet. So she'd say things like she had to take the stairs, one stair at a time going down in the morning because her feet and everything was just so stiff and sore, and took a long time to get her hands moving. And a high level of fatigue. So a bunch of things that she was struggling with after chemotherapy. We did twice weekly acupuncture for 2 weeks, and then once weekly for another couple weeks. And she had about, it's probably higher than that. It's probably a 95 or a 97%. It was her recovery of the pain and burning was almost completely gone. And she'd also reported significant improvements in her hands and feet. She didn't really notice that feeling of stiff in the morning, noticed that she felt more comfortable on the stairs, things like that. And she'd said that her energy had never been better. So in summary, I say, wow, acupuncture can help a lot. And this is kind of why I say in my bio that I honestly feel there's hardly anything acupuncture can't treat. Sometimes I'm actually still kind of surprised by how effective it is. And sometimes I might question whether it might be able to help someone. And it really is amazing how well it works. So hopefully that didn't just feel like a long presentation with just a whole list of side effects, but in a way, it kind of is, as you can see, there's a whole host of cancer-related, chemotherapy-related, treatment-related side effects and symptoms that can be really effectively treated or reduced in frequency and intensity, like I said. It's a safe, relaxing, and overall enjoyable treatment for people. It's kind of it's self-care, right? It's you time. People come in, it's dark, there's music playing, they're cozy with pillows and blankets, and it's mostly enjoyable. As you may have noticed too, most of the studies here are just from the last couple of years. So there really is great support for acupuncture and research, and clinically, it has never let me down. Here's my contact information if you have any questions or you wanted to reach out and see if you think acupuncture might be able to help you. Thank you very much to Wellspring for having me tonight as your guest speaker. I really hope that your members found this informative and can use this as a resource long term. Thank you.